this particular event is to announce the launch of Manipal Comprehensive Liver Clinic. And they already explained the need for such a clinic because liver patients in general actually are not able to have a proper follow-up care because of not having a comprehensive kind of a program for them. So this particular program aims at having methodical approach wherein right from the diagnosis to the treatment part is continuously monitored, and wherever intervention is required by the specialist, that particular intervention is provided through a well-organized or a proper program that we have launched. So what happens is, typically if a patient comes, and as Dr. Tantri mentioned, there are a lot of aspects which are neglected. So we have arrived at a program wherein there is a software where we will actually record all the details of the patient who are diagnosed, and there is a program in which actually what is to be done and who has to intervene, everything is mentioned, and patient is kept informed about the entire thing. So through this we are able to effectively provide the treatment, and the patient will have a lot of benefit. And in addition to having a senior team of medical gastroenterologists and reputed surgical gastroenterologists, we also have a team of liver transplant surgeons based out of Bangalore and integrated with our team here. And they have been providing these services for quite some time, and we have done a lot of liver transplants across India in all our hospitals, particularly in Bangalore, and few in Mangaluru recently, and we aim to actually kickstart this program at a much larger scale, wherein we'll be looking at having, on a regular basis, liver transplant at this hospital. And we have already developed an entire team for this, and we'll be strengthening the team by having more specialists joining us for this particular venture. And as both Dr. Anurag and Dr. Tantri already mentioned, we have a team of multidisciplinary team to approach this, ranging from medical gastro, surgical gastro, liver transplant specialists, and we have psychiatric team, radiologists, and all kind of diagnosis. The entire team will be involved in the entire process. So that gives the comprehensive care to the patient. I think this is something which is for the first time being done in this entire region, including from the entire coastal Karnataka and say from Mumbai to Kochi. So I'm sure this is going to benefit a lot to all the patients who require this particular care. So I wish this program a great success and congratulate the team for launching this particular clinic, and I'm sure patients will definitely benefit from this. Thank you very much.
Speak in English only. Yeah, so good afternoon to everybody. So this advanced care in the liver disease is a requirement because liver diseases are the most common reason for which we get our patient admitted in our hospital. Once a patient develops a chronic liver disease, he has a long course in which he requires multiple visits to the hospital. This patient of cirrhosis is liable to undergo many complications during the course of disease. For example, they develop fluid accumulation in the body, or they may have blood vomiting, or they may have altered sensorium, or they may develop multiple infections. All these complications have to be tackled by the gastroenterology at the earliest level. Many of these patients actually land up in the ICU, and these patients require expert ICU management. Therefore, in our team, we require the expert intensivists. Then they may come with GI bleed or vomiting of blood, in which we have to, mostly we will be able to tackle that bleeding by endoscopic method. We will be able to control the bleed. But sometimes we do require our interventional radiologist to stop the bleeding. So therefore we have intervention radiologist, Dr. Kirtiraj, to stop the bleeding. Then these patients are almost always malnourished. They suffer from malnourishment, so they require nutritional counseling. So we require a dietitian who will be able to give expert advice regarding the diet to be consumed by these patients. These patients, over the course of time, you may require that his liver fails, and then the option of transplant has to be explained to the patient. So we require transplant coordinators. And to do the transplant, we require a surgical team who are expert in hepatobiliary surgery. It cannot be done by most of the persons, so we have a tie-up with Manipal Hospital, Bangalore team also, as well as our own surgical gastroenterology. They perform the liver transplant. We already performed 7 or 8 liver transplants successfully in our hospital. So all this requires a multidisciplinary team for which we require help of each and every department of the hospital. For example, many of them are actually alcoholics who consume excess alcohol. So in these patients, we require psychological counseling. So we require a counselor in our team. So that also we are arranging for that. So the patient who gets enrolled in this Manipal Hospital Advanced Liver Care System will have the benefit of this entire spectrum of the care which can be given to him. Otherwise, he has to run from one doctor to another at multiple times. So that becomes very difficult, or one or the other aspect might be neglected if he does not get involved in the advanced liver care system. So that is the aim, to provide a comprehensive care for these patients with chronic liver disease, that we are launching this card. So once he gets enrolled, he will be given quite a lot of benefits. So that is overall beneficial to the care of that patient. So in future, whenever he comes for follow-up, everything would be recorded in the computer. Secondly, he will be thoroughly investigated, and all aspects of liver disease will be covered when we enter the data. So he has a problem nutrition, he requires counseling for de-addiction, he requires multiple medication, reference to surgical gastroenterology. All that will be recorded in that data, and patient gets the care which will be given to him will be much better than going to the individual doctor. Otherwise, he has to come and see me once, then he has to go to the psychiatrist, then he have to do the ultrasound, he'll go to somewhere. Here we will have a dedicated radiologist. Dr. Santosha has come now. So he is the dedicated radiologist who will be doing the ultrasound for those patients. Requires a special person to do the ultrasound for these cirrhotics. Not easy to do ultrasound on a cirrhotic liver. It is already damaged. Sometimes you miss the cancers in these patients. So we require Dr. Santosha to give us information whether or not these patients are at increased risk to develop liver cancer. So if we detect it early, these people are there to manage it. Dr. Satyanarayan and his team are there to take care of the surgical aspect. And Dr. Kirtiraj, not seeing it, he is able to burn the liver cancer by radio frequency or by microwave. He can do that, and the patient can be treated without surgery also, if we detect at an early stage. So all these benefits will be there once he gets enrolled into the Manipal liver healthcare system.
News Karnataka.